If you look at your calendar, the deadline to enroll in the Affordable Care Act is really fast approaching. It's November 1st. We're seeing a large number of young people opting out or hesitant to enroll, and it could be because of headlines like this. Millions of people are getting denied health insurance claims every single day. We sat down with the founder of CAREYA'S and the chairman of Counterforce Health. His name is Neal. He's been through this before. His wife was diagnosed with cancer in their 30s. They had to sacrifice everything to get her care because they continued to get denied.
The average 30-something that goes through a major healthcare crisis has less than $400 of savings. So if the insurance doesn't cover you, you are absolutely screwed in that situation. And more importantly, another very shocking statistic. Last year, about 500,000 Americans filed for personal bankruptcy. 83% of them had insurance. 70% of them filed because of medical bills. So of that, you think about the majority are filing personal bankruptcy due to medical bills.
Shah has gone through this before, which is why he wrote an entire book about it. And now he's developing technologies through Counterforce Health to help people like you and me when we do get denied. It could be something as simple as a code. But what he says is that there's tools, tricks, and hacks to outsmart some of these big insurance companies. You and I have worked together in the past. What I think is most inspiring before I push you on some of the numbers that we're seeing and of course have you confirm them is just your personal journey with the insurance companies. We talked a little bit prior to recording, but the story that you tell when your wife was diagnosed with cancer is really mind-blowing, and it's really not that unique, right?
Yeah. It's happening to so many people. So at that time we were in our mid-30s. I'd actually just gone through a multiple years of caregiving experience for my grandfather through dementia and end of life. And then suddenly my wife became diagnosed with a very aggressive breast cancer, fast growing, harder to treat. And, we were both working, in our mid 30s at the time. And she immediately had to take time off work and deal with treatment that went on much longer than expected. I had to take a lot of sabbaticals from my work to help her. And then eventually I left my work to become her full-time caregiver. And during that process, there were so many denials of claims. And we thought we had like Cadillac health insurance, we've been paying into this since we were 22 and right new into the workforce. So we've had almost 15 years of health insurance payments. And yet, and none of us have been sick. And yet when one of us gets sick, just denial after denial, chemotherapy drugs denied, major surgery denied, bills upon bills for routine visits and procedures denied. And when one and then both have stopped working and are just like spending savings to deal with a health crisis, it's like insult to injury when you have tens of thousands of dollars of denials. And, fortunately, we were in a position where we had savings where we could just eat the cost and deal with the stress later. But I think what was most eye-opening and frustrating to me is I was in so many cancer support groups, for people caring for family members, and many people were not in that financial situation. So they were literally foregoing essential care that they need or their loved ones need, foregoing chemo, foregoing surgery, trying to save up to get it. And I thought this is just like heartbreaking, where people have paid into a system and they're not able to get the care they need when it comes time, to need it. That was really the inspiration for this work.
You talk about being in your 30s. You don't plan or feel like you should be diagnosed with cancer in your 30s. Yeah. And to say that you had savings really is unique, right? I mean, I look at some of these headlines and you see all these young people who are opting out of paying for health insurance because they simply can't.
Yeah.
So you're in this position where you're unique that you have savings, but you're also dealing with the fact that you're in your 30s. You're not supposed to be diagnosed with cancer. So you think to yourself, well, at least I have coverage, and then you don't.
Yes. And I'm glad you brought up the point about savings because you're right. It wasn't a unique situation. The average 30-something that goes through a major healthcare crisis has less than $400 of savings. So if the insurance doesn't cover you, you are absolutely screwed in that situation. And more importantly, another very shocking statistic. Last year, about 500,000 Americans filed for personal bankruptcy. 83% of them had insurance. Sorry, I skipped over this stat. 70% of them filed because of medical bills. So of that, you think about the majority are filing personal bankruptcy due to medical bills. And usually it's a major crisis that they have, like cancer. And 83% of them do have insurance. So what does insurance, quote unquote, mean anymore? Like if it's not there for you when you get cancer, why bother paying into it? So I think it's absolutely heartbreaking.
Well, and you've done the homework and the digging. What what are we buying? What I pay insurance and I'm
Yeah.
still, I mean, I
Yeah.
still have to pay all these medical bills. So what am I purchasing exactly?
I think people are buying like a fancy like payment scheme combined with like a little bit of a negotiation scheme of like slightly cutting deals with drug manufacturers and PBMs to slightly lower prices. But I think you're not buying much, to be honest. I think many people are better off in a private pay market, just kind of like putting aside their savings. And I think to your question about what we're buying, I think about this: tens of millions of Americans in about 2.5 weeks, November 1, are heading into what's called open enrollment period, right? Where they decide their insurance for next year. Everybody on ACA plans, every older adult on Medicare and Medicare Advantage plans. So I think it's over 100 million if you combine both of those. So it's a huge, huge decision, right? This is one of the most important financial decisions most Americans will make for the next year. They're making it in a complete vacuum. Zero transparency on what they're getting. Here I live in North Carolina, and you go into the ACA marketplace, or you go into kind of like your Medicare Advantage choices. Yes, sure, you can look at 3-5 different insurance company choices, the plans they offer. Can you tell anything about what's the likelihood if I get cancer that this plan will deny chemo? No disclosure of statistics. You can't even get a straight answer from the insurance companies on what was your last year's claim denial rate. And a lot of news organizations and investigative journalists have published these, and the insurers always dispute, but there is no publicly available data. Some insurers are now pushing over 20% denial rates. Some insurers, who you may know by name, have almost a 30% denial rate of claims. The average insurer now is pushing over 15% in America. So you have zero transparency on what's happening. And based on your health, your current conditions or your future conditions, will you actually be covered? So I think it's really heartbreaking. People are making these important financial decisions in a vacuum, and meanwhile, they're paying top dollar. These premiums ain't cheap.
I actually was speaking with another mother about this
Yeah.
week, and she's self-employed with her husband. She's got
Yeah.
2 girls. I could probably ask her to come on the show. And she said she was looking at the ACA website, and it was like $2,500 a month. And she's like, we do really well, but we hustle. We don't work for anyone. She's like, we just can't, like, this is a huge part of our budget.
Yep. And worst of all is you pay that $2,500 a month, and then something happens and you're not going to get it. You're either going to have to pay massive deductibles, or you might get denied and have to get into a massive bureaucratic battle. So, in a situation like that, wouldn't you just be better off putting aside savings gradually in a tax-deferred HSA account, and over time accumulating it? I think many people who go through these serious illness do the math and realize they would have just been better off contributing into HSA. But I think that's really, really sad that, and particularly this year, because of like all the government debates and everything, people are really seeing the cost skyrocket, because for years the government was subsidizing it.
Right. Well, and for someone like me, my first thought is, where is all this money going?
I have an answer for that. Health insurance companies' pockets. Since I'm not a partisan person by any means, right? I'm pretty apolitical, right? But since Obamacare was passed, $400 billion have gone straight from Obamacare plans and government spending into health insurance profits. The biggest beneficiary of Obamacare is United Health, $160 billion. And there have been investigative reports on this by Jacobin and Lever report, which I would highly recommend people read. So these schemes, that really marketed to the population as, oh, we're going to get everyone healthcare. It's really kind of like a scheme of, we're going to force everyone into buying health insurance, penalize if you don't, have no control on whether or not you actually get the coverage if you have a major catastrophic illness. And by the way, government is going to spend your hard-earned tax dollars on just giving handouts to health insurance companies. So the money has gone into the health insurance companies, not to people's care. So I think it's really sad.
If we're holding other, if you look at, and of course, like you said, we're just trying to provide people information. So I'm not trying to do fear mongering or claim that it's some type of a pyramid scheme. But at the same time, companies are found guilty, private companies. Yeah. So why are health insurance companies essentially getting away with this? And is there any end in sight?
I think that the lobbying and not to like target necessarily companies. I think health insurance in the past, had been working better. So it's not that the industry, kind of by existence is flawed. It's the industry today. And the way it's developed over the last 10, 15 years has gotten completely out of control. I think the health insurance companies have extremely powerful lobbying interests in DC, both parties. If you study the history of the revolving door, The person who led Medicare and Medicaid under Obama Marilyn Tavenner, went to become the CEO of AHIP, which is the health insurance lobbying organization, right afterwards. Who was her replacement? A United Health executive who had a bunch of stock in the company, was allowed to take over Medicare and Medicaid, and was given an ethics waiver to be able to kind of, oversee the program where the biggest contract beneficiary is his former employer. So, you have this revolving door between people who are setting health insurance policy in DC and people who are leading large health insurance companies. At the same time, over the last 15 years, there's been an unbelievable series of mergers and acquisitions to the point where 3 to 4 large completely control the market. So my prior background, I was a hedge fund manager before I became kind of an entrepreneur in healthcare. And I really love free markets. I'm a hardcore kind of free market capitalist, but I also recognize when markets aren't free. And I think this is not a free market. This is a collusion market with 3 or 4 companies that box out any competition, that have bought up every other competitor in sight, and that now kind of price collude and that keep innovation out. So if I wanted to start a health insurance company because I'm not pleased with the plans on offer to me in North Carolina, I can't start one. And wherever you live, like, you probably couldn't start one. So there's no innovation going on. So I think that's why that you have market concentration, series of mergers. They control up and down the supply chain. So health insurance companies bought each other, but they also bought pharmacies. They also bought, I think 10% of doctors in America are directly or indirectly employed by United Health subsidiary. So you have like a lot of kind of power concentration that doesn't allow for a kind of free market and price discovery, and you have no price transparency to the consumer. So yeah, I think it's a tough industry the way it's set up now.
There are, so your advice, so if parents are listening to this, or families, or even single young people, because we use that example, one of the producers on our team is dealing with these insurance claims being denied, and he was planning on them not being denied, right? So this is something that that you newly have to budget for. You mentioned there essentially is a monopoly, or it's really hard for companies to break through, but are there other options? Are there, I know that there's different religious options, or people that have these private health insurance. Would you encourage people to explore that, or would you encourage the HSA avenue?
1,000%. I encourage people to explore all options and become kind of educated about it. It's one of the most important financial decisions you can make. And you want to make it thoughtfully when you're healthy, to plan for when you get sick, because you don't want to make it after the fact. So I'd say first, with the person that you're referring to that is currently experiencing a denial, there are ways to fight back. A denial, I think most people, and I wrote about this in my book, most people don't understand that a denial is not final. That a denial is just the start of a back and forth negotiation with the health insurance company. And I think most people view it as, oh, well, they know about healthcare, I don't. So I'm denied XYZ, that means I'm not going to get it covered. That's definitely not the case. We find that 99% of people don't appeal denials, but of the 1% who appeal, 40 to 50% of them win at baseline. And if you do a more thoughtful appeal with much more robust research, you can increase your winning odds to 70 to 80%. So my number one goal through my work now over the past year is, let's help as many Americans appeal denials as possible. And let's do it in a thoughtful, robust, high quality research way so they can win. We built free AI tools here at Counterforce Health. That's kind of like our organization. It's a social enterprise funded by government grants and grants from research universities. We built free AI tools helping people automate appeal. What we would call the way Amazon did with one-click delivery. If I lost my phone charger, I go on Amazon and one-click it, it's here tomorrow morning. Right. Similarly, if you have a health insurance appeal, put your information into counterforcehealth.org and you can appeal literally in less than a minute. And not just appeal, it's an extremely robust research-backed appeal. The models are trained on tens of thousands of appeal strategies. They're trained on and have real-time access to medical research databases to prove why you need XYZ chemotherapy or why you need a certain rheumatoid arthritis drug, and back it with robust medical evidence. And we find that people are reporting over 70% win rates when they do these appeals. So I think that step number one is, if you ever find yourself in this situation, view it as a negotiation. Don't just assume denial means I'm not getting covered. More importantly than that, you have 3 or 4 appeals to the insurers. It's called an external review. I wrote a detail about this in my book, and I'm happy to send anyone a guide if they email me or reach out to me. but there's a detailed process in every state to external review, which means the state insurance commissioner will appoint independent third party to arbitrate it between you and the insurer, and you don't have to pay anything for that. Over 80% of people win those. And then worst case, if that fails, you can always take them to court and litigate, and the majority of patients will win in litigation. So there are multiple steps you can take. You don't even have to take them all. Simply trying to take some of those steps will make the insurance company back off. I think a lot of times this is a game where they're denying it, thinking, oh, the person's not going to do anything. Why not pocket the money? Because there's no penalty to them. So if you just simply push back, it starts creating pressure on them. And there are penalties to them for the further steps.
If you think about it, I mean, we negotiate everything. We negotiate with our partners. We negotiate with our children. We negotiate with our schedules. You were talking about all the steps that people have to go through to appeal, which really you're making it more simple. But if you look at some of these reasons, and again, this is an easy Google search, so it's not like information was hard for me to obtain. We're getting 34% of denials for other or unlisted, 18% for administrative, 16% for excluded services, and then you have lack of prior authorization and lack of medical necessity. What I'm saying is, like, these are all of them are very vague. Like, I mean, there's a couple that are very, very clear.
Yeah, I'm happy to simplify that, for the audience. So, in our research, we added up and bucketed those, and we believe that approximately 75% of the denials are fairly easily appealable, and 20 to 25% of them are not. And the excluded services is kind of the category where it's explicitly not covered under your plan or explicitly out of network, is generally not, barring an emergency, or extenuating circumstance, right? But the remaining 75% of them, if I had to oversimplify it, I'll categorize it into two buckets. One is administrative and billing related errors. And by that, I mean, the visit was for a emergency appendectomy because, your appendix was about to rupture or had ruptured and you needed kind of surgery right away. And it was misclassified by a certain code to be routine abdominal operation. So therefore, okay, you went to the wrong doctor and you didn't get pre-approval, and okay, we're not going to pay, right? That is something easily fixable. Like, our AI system can figure that out. But, more importantly, and we see people processing these through our AI system. More importantly, this is something the insurance companies should also be able to know, right? They have AI too, but conveniently they're not doing it, and they're denying it, and they're putting the burden on you to stress out and figure out. So how's a regular person supposed to know what is the right billing code for an emergency appendectomy? Like, sure, you can go to Google, you can go to ChatGPT. A lot of resourceful, maybe younger people or middle-aged people will figure that out. But a lot of people, without those resources won't. A lot of older people, who we help, a lot of older people are not necessarily going to be able to figure this out on their own. So I think that billing and administrative coding related errors, extremely, extremely easy fix. That's about 20 to 25%. The remaining kind of like 40, 45% is this gray area of what's called not medically necessary or medical necessity. And that is a complete gray area. And that is something where the insurer is saying, why didn't you try something cheaper? And then you have to prove, well, I did, or my doctor said it won't work. So, we had a great example of this where there was a woman recently that we really helped with a kidney cancer, and she had a tumor on her kidneys. And multiple surgeons professionally opined it is way too risky to cut that out because of where it's located. There could be major damage to the kidney and to other organs. And, she's not in amazing health overall because she's kind of like a little bit more advanced in age. So they were like, there is only one way to treat this, and it's proven and it's effective, and it's microwave ablation, where you don't have to kind of go in and excise it out, but you can treat it with like microwave ablation. Insurance denied it left and right. And the surgeons were like desperately writing letters. And it was just like, they were saying, hey, this is the only thing we can do. This is the only thing we can do. She was writing emotional letters, and, they were completely ignoring it. Thankfully, her husband happened to hear about us on a show, like on radio or something, and was like, oh, I'll check out the site. There's free AI tools. And came to our site and, put in all their information and got like a very robust research-backed appeal based on her history, based on her policy coverage document, based on her denials of saying, okay, logically, here's all the reasons why we can't do X, Y, Z other procedures. This is the only reason microwave ablation works. Put that through, got it approved, got it done, and she's cancer-free now. So that's kind of an example where most people would panic. Like, she and her husband don't have 45 grand lying around, so like, it's either not going to happen or they're going to go into massive amount of debt to do it, or in the meantime, they're going to have a tremendous amount of stress. Can you imagine if you're dealing with this kind of cancer, the last thing you need is this existential stress of I can get it out, but the insurance is not paying for it. So you're under this massive amount of stress. If you can solve that for you, that's a home run. And, I think that's one where the insurance company should know better, but they're creating the burden on you of, oh, please write all this detail. And if you're fortunate enough to have a brother that's a doctor who will sit there for 10 hours and write all this step by step, great. But most people aren't. So, they're going to be screwed. This is where I think AI and just kind of innovation can really help. That this is kind of like having, a doctor in your pocket, so to speak, where somebody with a legal and medical background, which is the AI, can do this for you in seconds and do it in a very professional and robust way that can help you get the care you need. But my long-winded answer, sorry for your question, but the 75% of reasons for denials are very easily appealable. And I feel like they're just kind of BS reasons to put up roadblocks so people don't get the care.
Well, it's BS, and it feels like you're capitalizing on someone in emotional times. Like,
Yes.
to me, it feels very David and Goliath, and it feels like you have two people at the table, and one of them is in a state of grief or a state of panic, and they're thinking of finances and their health, and the other person is this monotone robot. That's like, when you describe these scenarios, it's like what I'm visualizing is two people at the table, and it's just not a fair fight.
Yes.
And I'm just thinking, and you're telling me all these examples, and I'm like, how do we get here? If I do a Google search and it says there's 200,000 denials a day, and that's just with ACA, that's not including Medicaid and Medicare. And I'm thinking to myself, how many of those is someone's life on the line? Like,
a lot.
That's what I don't know. I'm like, how do we get here?
Yeah, a lot. So, and thanks for bringing up the stat. 1 in 5 adult Americans have had who are on health insurance have had a claim denied within the last year. And in aggregate, there were about 5 billion healthcare claims going through the American healthcare system last year. 850 million were denied. And of course, there's only 300 million people in the country. So if you kind of do the math, it's the sickest people who have multiple interactions with the healthcare system every year who are being denied routinely. So we have parents of kids with special needs, parents of kids with like major illness, rare disease. We have young people who are going through suddenly a major cancer. We have midlife people, kind of like my wife and many others that I've met are suddenly going through breast cancer, colon cancer. And by the way, these rates of these cancers are really skyrocketing in people in their 30s and 40s. So it's hard enough when you get this, but it's even harder when you take time off of work. You're dealing with your existential stress of, am I going to die? And then you're dealing with financial stress on top of that of, oh, all this treatment that I need, boom, I got denied on something. And it's like, think about when you go through cancer, you're going to go through multiple interactions with the healthcare system. And if you have if you're kind of like rolling the dice, 20% chance of something being denied, well, a cancer patient over the course of this year might do 15 or 20 billable things. So it's likely you'll face multiple denials just if you play out the odds. And, I think that's a disgrace to the way our healthcare system is set up.
Well, and like you said, our goal here is not to necessarily make people angry at politics or to point fingers at politics. And for someone who supports capitalism, I'm thinking to myself, did it just get out of control? Did it just did the beast just get too big? I mean, and everything always comes down to lobbyists. I did a show on this. We did a show about like, why are our kids getting strawberry milk at schools? And it's like the one woman I spoke with was like, don't F with the dairy lobbyists. Like,
I think, and you're right. Like, I also believe in capitalism, and I feel like capitalism, the best of it is free market competition and government out of it. I think that, I kind of believe there's two spectrums of society and the way things head that don't work. One is government does everything. I generally think that model doesn't work. And that would be traditionally called kind of like communism or socialism, right? But another model is where government does a bunch of things and prioritizes a few businesses and then massively allows those businesses to get concentrated, what would be called maybe crony capitalism, which then works pretty similar to the former model, where you don't have a lot of rights. The best model is when there's a freely functioning market of robust competition. If you don't like United Health, you can go switch to 100 other health insurance companies, which is what used to be the case 20, 30 years ago, right? Like, and I think that this became a hot button point, I think, for populist kind of sentiment, with the Luigi Mangione and United Health shooting. And it's like, well, that kind of stuff doesn't happen in free market capitalism because people have a lot of choice. They can just say, okay, I'm not going to buy from this one. I'm going to go elsewhere. Look at the car market, or look at your choices when you want to buy a computer. There's like millions of options. And I think that this market needs to return to that. But barring that, I actually think the freest market is where people get to control their own financial destiny. So if you put things like health savings accounts on a level playing field with forced buying of health insurance, and you can say, well, you can choose to contribute to this, or you can choose to have your tax-free dollars go to an HSA. Same with, by the way, it's not that the government just allows you to buy health insurance. The government funds a lot of health insurance, right? Correct. Through Medicare, Medicaid, as well as Obamacare subsidies. The government is spending hundreds of billions of dollars directly of taxpayer money. And I did the math that if all of this money was just given to individuals to fund their HSAs, like let's say you could give everyone a couple thousand in their HSAs, and then lower income people and senior citizens more, because those people are already currently getting it through Medicare, Medicaid. Like you could fund a lot of HSAs, and then all the other people, like the lady you mentioned who has her family and the $2,500 a month of premiums. Imagine that $2,500 a month going to an HSA. That's like 30 grand a year, basically, right? And over a course of years, you have built up an enormous amount of savings, such that when something happens to you, you spend on that savings. The last thing I'll say on this model, a true free market model, which Singapore does, is the cost of healthcare goes way down. Because currently in our healthcare system, 2 trillion out of the 5 trillion that we spend as a country goes into administrative waste, I believe. And if you just had your own money, you go to the doctor, you have price transparency, and you just buy directly, everyone's better off. Doctors making more money, it's a faster process, you're spending less. Right now, the insurance companies are dictating also what the doctors can do, what the nurses can do or can't do, and they all hate it too. So kind of to your point about alternatives, I think some of the happiest people I find who have good healthcare experiences are going to direct care. Like you see a lot of docs going to like direct primary care. I think a lot of the organizations that you mentioned are like religious or faith-based organizations running kind of insurance pools are much better. I think a lot of people are choosing to go to HSAs, and this people are doing despite of like penalties and stuff, right? Because like the way our health insurance industry works is everybody's pushed into it. So I see that there are really pockets of great innovation going on, but I think we need government to kind of step out of the market and allow people to, come up with free market solutions, because the system's very clearly broken.
I had a couple thoughts when you talked about they're also dictating the price. I mean, after a certain age, women, as you know, are required to get mammograms. And I, of course, didn't even think about it. It was covered by insurance. And I looked at the bill, and my mammogram was like, I think it was $7,600. It was, and I thought to myself, how many of these are a day? Why are they so expensive if technology is so advanced? To me, that's what, and like you said, the wheels were turning where I'm like, oh my goodness, are they all working together? Is this a little bit of collusion? You're telling me that a routine mammogram is $7,000? It took me 7 minutes.
I know. And if you go cash pay, I bet you get a fraction of that price. So, and I don't know the exact economics.
Right.
Basically, my kind of guess from other people that I've seen doing direct pay care in these situations is it's $7,600, and then you have to hit X amount of your deductible, or you have to do X amount of copay, right? So you're still out of pocket doing whatever, make up a number, X 500,000, whatever. If in a similar market, you just go direct cash pay somewhere, you can probably get equivalent or cheaper, and I think that's like a lot of people are shocked when they ask for the cash price and just say, I will pay out of pocket, no insurance. They oftentimes get an 80 or 90% lower price. And then they do the math and they're like, well, even with insurance, I'm worse off than if I just pay cash for the whole thing. And then you realize, well, the provider, like they actually would prefer me to pay cash too, because they're not getting as much, from the insurance. So it's a artificial massive inflation of price. And I think that there's a hot debate going on right now. And what I'm most encouraged about is that there's bipartisan focus on this. I think that, interestingly enough, I observe politics, and this is one issue that I've seen Marjorie Taylor Greene and AOC agree on in recent weeks. They're both railing on this point, and you see them on X and Twitter and all their testimonies in Congress. But they're both saying and highlighting these cases of like, why is healthcare so expensive if you have health insurance? Like, what's the point? Yeah. And I think it's price obfuscation. People who go direct are just having a better experience. So I'm optimistic that this will change.
I also want people to feel empowered, because it does seem intimidating, but I want people to feel like they can. So, we explored different options, whether it be concierge medicine or what have you, because we were really alarmed, and we haven't taken the steps to do so.
Yeah.
But we're also two working parents
Yep.
who waited until our late 30s to have children, so we were
Yeah.
financially supported. All
Yep.
so I don't want to approach this without the knowledge that some people may not be financially settled. Like that
Yes.
they may not have the means. We have the means to make these choices, and right now we're
Yeah.
choosing insurance, but we also could, like you said, invest in an HSA. What about the people who you work with may not have that, right?
Yeah. I think, yeah, I mean, the people I work with, and frankly, a lot of the people that we help don't have these choices,
Right.
and they're forced into kind of current plans. If they have a choice, I would strongly urge them, because we're heading into open enrollment, so it's very timely to do this episode. I would urge them to just calculate different scenarios, and maybe even call the insurer and ask them some of these questions. But what I find, even people with more modest means, if they're on, let's say, ACA Obamacare plans, there is a choice of, am I going to pay a $2,500 a month premium, or am I going to find the lowest premium plans possible that have very high deductibles and literally cut my premium payments by a lot, and whatever amount of money I am not paying, maybe put some of that into HSA. So that way I'm actually better off in terms of I'm spending less on insurance, but I have it in case something disastrous happens. And then the rest I'm socking away for a rainy day. And I'm going to use that, to kind of get the care that I need. So I think actually in some way that shift is already happening to people. But yeah, I mean, I think otherwise, and oh, sorry, the final thing I'll say, because I also speak with a lot of middle-aged people who are caring for aging parents. And by the way, this is extremely important decision, because middle-aged people are worried about healthcare, sure. Younger people, sure. But where you should be most worried is when you're helping your mom and dad, because healthcare needs in the last 5 to 10 years of your life, that's where all the money is spent. There's an interesting statistic that last year, 50% of healthcare spending in the US went into people in the last 2 years of their lives. Yeah. So, it's kind of like when you really think about bankruptcy level healthcare, that is happening a lot. So if you're helping your mom or dad, if you're like a sandwich generation, middle-aged person taking care of kids, mom and dad are also kind of going through this process. It's changed so much that they don't know what to do, and they're really marketed by these Medicare Advantage plans. Make sure you really help them thoughtfully figure out which plan is right for them, because that's really when it'll financially break the bank.
I mean, that's a whole episode.
Yeah.
We've talked about that, our producing team, because there's such a generation that I'm in, that you
Yeah.
as well, where we still have young kids. We had kids later, and then we're taking care of aging parents. So we're probably going to approach that.
Yeah.
When you did a lot of your research for your book, what did you find most surprising? And I want to couple this with, do you feel like when you see Marjorie Taylor Greene and AOC agreeing on something that it will get better, especially with all of the things that you've learned?
1,000%. And it's because I found surprising how many people are extremely frustrated with the system. Like when I went through it first, I thought we were just alone bad luck. Then I talked to a lot of other caregivers who are dealing with, family members with serious illness. Then I was like, oh, maybe this is a sub community that is just like getting shafted by the insurance industry. And then in researching my book, ended up talking to a lot of people in the healthcare system. And then that was like really the eye-opening of how many nurses, doctors, social workers, even hospital administrators are so frustrated and fed up with the system that it's not even working for them. And really, I think the most surprising element of the entire book, actually, which isn't even related to like directly what families are experiencing, but indirectly, is this idea that doctors and nurses, one of the main reasons they burn out of healthcare and leave is because they're sick of what the health insurance companies are doing. Mm-hmm. Like they want to help you. When they see, oh, I'm the cancer surgeon and I can't do this procedure on this lady to remove her kidney tumor, and the insurance company keeps denying it. In some cases, the person doesn't win and they die. And at some point you see that over and over in your career and you're like, all right, I'm just going to quit. I'm going to go do something else. Cause I'm not able to do my craft. So I actually think that was the most surprising, that this is contributing to a burnout and disillusionment and healthcare workforce shortage. And I actually think the way our population is aging and the rising rates of chronic illness, we need more people to help people, not less. So I think that was kind of one of the most surprising things. And then on the other side, I actually found it very empowering that a lot of people who have been through this journey are doing things to help others. So like in my case, like if I'd not gone through this journey, I would have never thought this was a major crisis. So I'm thinking, okay, what can I do? So, okay, we can do technology innovation, build AI tools to help. Other people I found that went through these major journeys started, kind of small nonprofits or community organizations helping people with breast cancer, colon cancer. And there's some great patient advocacy organizations out there that are formed by this kind of experience of people. Triage Cancer is a big one. Patient Advocate Foundation is a big one, where they will literally help anyone who's struggling with this. You can call them. It's completely free, pro bono work. And the vast majority of people I find in this field dealt with it personally, found it very frustrating, found a way out of it. And then we're like, okay, now I'm going to spend a lot of my time helping other people go through it. So I think like power of the community is awesome.
Well, and you know what I love so much about the what you're creating with artificial intelligence. So often we do these stories like AI is replacing this and this and this, and what you're saying is actually we're filling a vacuum. There's no one who's helping these people.
Yeah.
Like
Yes.
there's no one taking on the insurance. You're literally, and I think that's
Yeah.
such a positive light for us to focus on, because so often we say, oh, AI is replacing therapy. AI is replacing your accountant. AI is going to replace your news person. But there's hundreds of millions of claims being denied, all of that money being funneled to insurance companies. And you're actually creating a tool where there is really not a lot of people doing this.
Yep. Yeah, I agree. I think your analogy earlier on of David versus Goliath, I think that's like the perfect analogy, where we need to give tools to David to fight back, because there's no way you're going to be able to fight back on traditional means, like spending 10 hours writing a letter. Most people don't have the knowledge, aren't lawyers, aren't doctors, so this is something where AI can learn, do it faster, do it much more accurately. And critically, as the system helps more and more people, the system gets better and better. So I think this is a great example of like how we can use AI to like help people at scale.
So blue sky for me, after everything that we've learned today, 5 years down the road, will the landscape look different? Will we see more competition because people are saying, hey, I'm going to do the HSA route, or I'm going to do faith-based, or I'm just going to just do self-pay, all of these different options? Do you think that things will look better?
Yeah, my prediction by 2030 is that the insurance industry is going to be a fraction of what it is right now. I think the vast majority of healthcare in the country is going to go into combination of HSAs, self-pay, faith-based organizations, kind of like other, because I think it's past a point of no return. It's so clearly broken. I think when you have different ends of the political spectrum rail against it, you have 2026 midterms coming up. I talk to tons of people on the ground who are like, most of our work is helping sandwich generation family caregivers care for aging parents. And I mean, to the person, people are so fed up with the way their own care and their mom and dad's care is financed and paid for that I think there's going to be major change, which I think bodes well for everyone. Free market competition, innovative care models, and critically lower spend, and I think more autonomy. I think can't emphasize that point enough, but I think the healthcare workers are so frustrated by this. And I think we need to encourage more people to go into these fields. So I think more autonomy. And I really like, if you look back 30, 40 years ago, this idea of like the independent neighborhood doctor, that kind of like ran their own practice, had direct relations with patients, your family got to know them. This is the way I kind of grew up. It's like, your parents knew them, and then maybe they even helped with your delivery, and then you're taking your kid there. I like that type of like community-based healthcare, and it is not like that anymore because of all this like insurance bureaucracy. And I think that if we kind of change the system, it will go back to that. And I think that's just like better for everyone. So yeah, I'm pretty optimistic about the future. And I think we're going through probably the hardest time right now, but sometimes you have to go through the hard time in order to get to a better. Yeah.
Well, and I also think you just encouraging people, and you have this wealth of resources and wealth of knowledge, and you say, listen, I've helped people. You don't have to have all the means. Like you said, you've helped people who are really struggling, because those who are suffering sometimes are the people with kids with special needs, or people who have health issues, and maybe they just feel like they're debilitated, and they're, like you said, it's the David and Goliath situation. So before I let you go, maybe top tips for folks who are facing this, who, like you said, there's some big decisions that are going to be made ahead of November 1st. So if you were speaking with a young family, what would you suggest?
Yeah, I think for families, like, go and do as much research as possible on the plans you're purchasing. It's going to be one of the biggest financial decisions that you're going to make for the next year, which plan you choose. And make sure you proactively reach out to the insurers and ask them just like very basic, polite questions about what percent of claims did you deny last year, common things that were denied, and then think through your own conditions. By the way, not that I love AI overall. I think there are some pros and cons with AI, but in a situation like this, if you really want to inform yourself fast, use ChatGPT or use our AI tools or use anyone's AI tools, but just go have brief conversations with AI, because it can AI is almost like your Google Assistant, where it's just going to do a lot of searches for you fast. So it will help find information and just plug in which plans you're choosing from into the AI and say, pull for me approximate denial rates for these plans. Then type in what are your current conditions that you or your family members are dealing with, or anticipated conditions. I realize that's kind of hard to do, but put those in and say, what's the probability if I choose XYZ, will I face a denial or not? I think that patient empowerment here is key, and there isn't a lot of information, but if you spend the time searching using AI tools, you can find a lot of info and then make a thoughtful decision that way. And then also highly encourage people to look into these self-pay and HSA and faith-based, options, because I think some of these are much better. And if you just simply read reviews, I think reviews and hate to say it, even Reddit, if a lot of middle-aged people aren't using Reddit, I would highly recommend it, because you can crowdsource these answers. Go to Reddit and go to forums and see what other families are doing. And oftentimes, depending on what state you're in, what city you're in, you'll find people using really innovative options that you haven't heard of. And you'll also find a lot of honest, positive and negative reviews of your different plan choices. But I think that health insurance, outside of maybe home buying, is probably one of the most important financial decisions you can make. And you don't think about it when you're healthy, but you realize as soon as you or your loved one gets sick that how important that financial decision was. And it is the number one thing that is leading people into personal bankruptcy. So, it's very important to be very thoughtful about how you make decisions. So yeah, empower yourself. And also, by the way, if you want free guides, email me or reach out to me anytime. I'm happy to send over a bunch of stuff. I'm very passionate about this topic.
Yeah, we're going to include everything in the YouTube synopsis, just because you really do have a lot of knowledge. And I think you would agree, especially with what you've been through, is that you don't realize pain, or even you don't have a good perspective until you've gone through health issues, or someone that you love has gone through health issues. Just how nothing else matters, right? Everything falls by the wayside. Like you said, you gave up your job, your wife, everybody, to make sacrifices. So we want to make sure that we remind folks that there are just so many resources out there.
Yeah, 100% agree. I think it's once you empower yourself, you don't have to be as pessimistic. I think you can be optimistic that you're at least prepared to anticipate what needs may come. And then oftentimes you're financially much better off.
All right, Neal, you're the best. We're so grateful for you. Thank you for joining us.
Great. Thanks so much, Liz. I really appreciate the opportunity.